Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. You may submit your questions or comments at any time during today's presentation by using the chat window located to the right of the slideshow presentation. Underneath that, you'll also see a window labeled Files where you may download a PDF copy of today's presentation. It is now my pleasure to introduce today's first presenter, Ms. Jen Braun.
Thanks, David. Hi, everyone. Good afternoon or good morning, depending on where you're joining us from. My name is Jen Braun, and I'm with the American Hospital Association and AHA Team Training, and I would like to welcome you to our bonus webinar sponsored by Barcoding, Inc. We're so happy to have them, Improving the Patient Belongings Tracking Workflow. You'll hear from Shane Snyder, who's the president of Barcoding, along with Phoebe Cresswell, who's the Healthcare Marketing Manager of Honeywell. Just a few rules of engagement for today. So audio can be accessed in one of two ways. The most secure and probably clear way is through your phone. The dial-in number is in that notes pod below the slides. Or if you have a strong Wi-Fi connection, you can listen through your computer speakers. Just so you know, if there are hyperlinks on the screen, they're all active and you can click on them. And then finally, there will be a Q&A session at the end of the presentation. So we encourage you to submit your questions as they come to you in the chat, and we'll kind of save them and curate them and do a moderated Q&A at the end of the session. So enough from me, and I would now like to turn it over to our first presenter, Shane. Shane, the floor is yours.
Great, thank you, John. I appreciate the introduction and the initial kind of housekeeping components to that. So thank you all for participating this afternoon. I know it's a very busy time. Sometimes we get tired of saying the word busy, but certainly you folks that have taken time out of your day today to attend, obviously you're in a very busy profession these days, and we very much appreciate you taking the time and hope to use that time as wisely as possible. So again, thank you to Jen for the introduction, and I will introduce Phoebe along the way. Phoebe is with our partner Honeywell on this. It's a project that we established several months ago, and Honeywell's been a key partner in doing this with us. So with that, I'll move forward past the kind of introductory slide there, and just give you an overall agenda of what we're hoping to accomplish during the course of our time together this afternoon. And we'll start with kind of that why is patient belongings tracking, and probably everybody that's on the line today has a little different spin at that, but certainly there's a lot of participation today, and anything we do with barcoding within our organization, we try to understand kind of what's behind it. What is it? Why are we going down this road? Why are we doing a development in this area? So I will talk to that at some length, and then talk to you about how we go about solving for that why. Secondly, how do we improve the process? The folks that are participating today, you folks are all experts in your particular field, right? You're experts in the healthcare space. You're expert in taking great care of your patients and your communities. Barcoding is expert in keeping track of assets and different things in the supply chain. And our hope with what we're going to present to you today is to give you where those two things merge: your expertise in the healthcare space and taking great care of your patients and delivering great outcomes. And as always, these things happen like this, right? You lose power. So literally, we just lost power in my office here. So the good news is I'm old school and I have things printed out here. So we combine these two things so that we have healthcare expertise along with folks that within barcoding that are expert at tracking assets. And last but not least, how does what we do or what we're presenting today impact your day-to-day lives out there? And Jen, because I lost power, which is fascinating, welcome to Baltimore City. Can you flip forward to the why track better patient why the need to track patient belongings better?
Yes, I will advance for you. Thanks.
Okay, thank you. At some point, my computer might come back on here. All right. And if you'll just skip forward to It's a New World, please. Have you advanced?
Yes. Yes.
Thanks. These aren't the things that you practice, but Jen, thank you for advancing the slide for me. So it's a new world, right? Everybody talks about the new normal, and all those things out there. Trying to, on the surface level, it's very cliche to say that it's all about the customer, all about the patient experience. But on your level, the people that are participating in this event today, it goes much more to a whole nother level, right? As you well know, much more is being asked of your groups every day in terms of, even during normal times, in terms of being very, requested to be that much more productive out there. But in these days, you have a lot more, a lot more stress on your organizations and the people that work in the organizations in terms of very fluctuating patient volumes and different census levels and different acuity levels, PPP or PPE, and all those things that enter your world today, all the while, continuing demands to be more efficient as well as, deliver that great customer experience, that great patient experience. Magically, my computer has come back, so that's a wonderful thing. So I'll be able to go ahead and advance these from here. So let's talk specifically about patient belongings tracking and maybe what it looks like in the world today and some of the data that we've collected around this. And we are seeing stories both within the healthcare community as well as kind of general publications out there that's speaking to this. We're able to glean some information from the New York Times over the last or back during the summer months. New York, as everybody knows on the phone here today, certainly went through, as we all did throughout the country, regardless of what region of the country you're in. Certainly went through an initial crisis with this COVID response, and these are some of the things that the folks from the New York Times were talking about. Right? It's just a matter of there was such an influx of volume and such a pressing need for frontline workers to deliver care, all the while trying to keep track of patient belongings, that became a real issue within that healthcare community certainly in New York, but you can also see a quote in there from the Texas community as well, a little bit later during the crisis. And whether you're delivering those belongings back to a patient or a family member at the time of discharge or release from the facility, it really doesn't matter the value of the individual item that the person had. It's important that the people get the items back that they came into the facility with, and it's something that can have an impact on their overall patient experience. Some of the scoring that takes place is part of that, and it really affects the overall quality of care. All right, so these are things that we've seen in the marketplace out there, or seen in publications out there. Lots of challenges. You folks are the healthcare experts that are on the phone today. We talk about our expertise, but you're living these things every day, right? So you're constantly having to develop new procedures. How do you handle the volume of patients that are coming in and the variation of the types of reasons why they're coming into your facilities? Many of the folks that we're talking to currently, in the process of evaluating how do they manage property of the patients that are coming in, and lots of different changes in terms of revenue models within those healthcare facilities as well, right? Lots of hospitals, certainly here in Maryland, we're experiencing right now where censuses are going up, ICU beds or utilizations are going up, and we're experiencing across the country out there, and to the point where some in terms of impacting revenue. Some of those non-essential elective procedures are getting put on the back burner, and that's certainly impacting kind of long-term health care, but as importantly, it's affecting revenue streams within facilities out there, right? We draw that or overlay that on top of kind of this new expectation as consumers of things, whether I'm a consumer in a retailer or an e-commerce transaction, or I'm a consumer of healthcare services, right? People are much more educated. People expect a higher level of care, a higher level of transparency, a higher level of visibility to what's happening to them, and in this case, very narrowly focused, what's happening to their individual belongings out there, right? And that patient experience, as you all know, and probably know it better than I do, can impact revenue and your different scoring systems that are out there. Lots of different folks doing scoring systems in the healthcare space. So other things that we're seeing out there in the space as we're working with different healthcare facilities, healthcare providers throughout the country, and these rules change kind of day to day, week to week, just depending on what's going on in their particular area. And things like families are not permitted into rooms, right? Meaning, if I don't have a family member there, then who's going to take care of my things along the way? I can't hand my wallet to a loved one, a relative that's out there. I have to make sure that the facility that's providing that care is taking care of my belongings, right? There's always the issue of contact, right? I just took a trip. We were talking about as we were preparing for this call. I was just, took a plane flight over the last week or two, and minimizing contact in that environment, very difficult. Certainly, we're trying to minimize points of contact within the health systems themselves, right? How do I deal with the different types of bags, the different types of storage devices that are within healthcare systems to help manage that contact that are out there? And also, and as always, this doesn't really change with the COVID response, but, severity of cases, there's times when people can actually sign for for their personal articles, and there's times when they can't. So how do we deal with that out there? In today's world, or what we've seen over the past several years as we've researched through this, people are kind of solving this riddle in different ways, right? Some folks are still using, and fair enough, right? It's not always a bad thing, right? But using kind of a paper, pencil, or an Excel-based process for capturing this data, recording information, and keeping track of patient belongings that are out there. Right, you can see some of the items that are associated with that, right? It can be prone to error. It can be inconsistent out there. It's time intensive because not only do I have to record it manually, but then I have to key it into some other system and retrieve that information. There's add-ons to certain of the EHR systems that are out there. Again, maybe some good reporting within there, but somebody has to record it manually and then turn around and key it into something else. And then others that we've worked with are using more systems that are designed for another segment of the market, kind of this evidence tracking system, which are in great detail, but they're not particularly well formulated from a user interface, from a usability standpoint to keep track of patient belongings. Right? It really doesn't consider the type of volumes and the variation of volumes that are coming through. All right? So just some examples, and some of the folks that are on the line right now might recognize a manual sheet like this, right? Nothing wrong with this sheet, but we think that there's a better way to do this, capturing the information once and having it automatically captured. So a very traditional methodology for capturing information around patient belongings, right? And then you'll see other systems like an EHR system that's designed to do it, but still somebody has to feed that. It's a very manual process that's out there, right? And then last but not least, kind of those evidence tracking systems, which, although they're good tracking evidence, but you're not dealing with the types of variations, that you're not dealing with kind of that human interaction component that you would deal with when you're trying to keep track of patient belongings, right? So it really doesn't present itself as something that from an appropriate system standpoint in a healthcare setting, not something that's terribly user-friendly, or it doesn't have the kind of efficacy that you're really looking for. So if I'm not, so kind of define the space out there, kind of what's going on and why it's important for us to keep track of patient belongings, talk about some of the things that are going on currently in your industry and our overall environment, ways people are trying to solve for it. And so what if I continue down that same path that I've always been on, right? What we've seen and the information that we're continue to gather from the folks that we're working from is that in kind of a mid-sized hospital, right, it costs them a couple of $1,000s a month in lost property claims, but you know that's kind of the tip of the iceberg, right? If I'm having to pay out claims, nobody likes to do that, right? But maybe it's more important to kind of keep track of this because of the time delays, right, which impacts patient experience, right? I'm not sure that we always have as many frontline workers as we need, right? So why use up more nursing time to take care of something like this if I can do it better, right? Why engage other people within, whether it's security, administration, or other parts of the hospital that are out there, to be able to deal with something that could be dealt with through a more systematic approach for keeping track of patient belongings. So why is it worth focusing on? You know, I think that a lot of the folks from that are on the line today, you know, could probably check some of these boxes, right? We haven't talked about cost of the system at all yet, and we probably won't talk in great detail about. Happy to answer those questions individually, but it's the kind of thing that you can, you know, sometimes around here I'll say, do the easy things easy, right? It's one of those low-cost kind of solutions that's out there that can solve a lot of different problems, from patient experience to freeing up frontline worker times to alleviating kind of additional paperwork or additional points of contact for administration, right? So low-cost, high-impact kind of initiative. In terms of direct financial impact, you know, we believe that most hospitals that we deal with, and hospitals come in lots of different sizes and shapes, from small to medium to large to university settings to for-profit, not-for-profit, community-based, et cetera. But on average, we believe that it will kind of save most hospitals at least $100,000 a year on an investment that's less than $50,000, right? It allows you to do things like, you know, scorecarding in terms of, you know, your effectiveness in terms of tracking patient belongings and making sure the number of claims that you have goes down relative to the rest of your peer group that's out there. And then last but not least, you know, there's so many people that do different surveys and different measurements of different healthcare providers out there. People like to leapfrog, where, you know, they're measuring, you know, kind of the discharge process and the efficacy of and the efficiency of the discharge process. Well, you know, part of that discharge process for most people is getting your belongings back. And, you know, why have that easy thing, that simple thing of making sure that we're returning belongings, all of the belongings in the same order that I got them, through a more automated way, is a way to not take a negative hit on an evaluation around that. So let's talk about the system itself, and we've got to set it up to go down through here. So these are the kind of the core pieces that we talked about in terms of designing and building out and deploying this system. All right. Certainly, we want to eliminate the errors that are out there and the inefficiencies that are out there. We want to capture information one time and have it flow through the entire system, so that once I capture that information, I never have to key it into another system that I always have visibility and transparency to that information. Make sure that we capture all of the information, right? Attaching a photo to a patient belonging record is, kind of the picture's worth 1,000 words sort of a thing, right? Make sure that we have the ability to actually capture the image of that unique asset for that particular patient that's out there. Create a set of standard procedures internally and externally. Create visibility to the patient in order to be able to see where their belongings are. So in its simplest form, who took my belongings, when did they take them, where did they take them, and where are my belongings right now, right? Overall impact, let's have an increase in overall patient satisfaction. And so as we built out the solution, right, it's a mobile application that's based on a set of cloud applications that are out there, cloud apps that are out there. Make sure that we've got property bags that are appropriate to track this. Make sure that we can capture information either off an existing wristband solution or add a wristband solution to it. Make sure that we can use mobile devices so we can capture. It's kind of like when you do point of care scanning. We would want to do the same thing where we can do point of care or point of collection scanning with a mobile device. And that might be a purpose-built Honeywell device, which we'll talk about in a second, either a full mobile computer or a sled that sits on top of an existing computer system out there, or in some cases, people will want to use iPhones, or they're going to want to use Android-based things like Samsung phones that are out there that are already available out there. Let's make sure we're capturing with a barcode so that we have accuracy and consistency, and make sure that we're capturing it not only in terms of the valuables that were captured, the bag they went into, but also the location that they went into. It gives us full chain of custody visibility to the overall patient belongings capture process. So I mentioned a couple of different ways to capture this, talking about a mobile computer from Honeywell, and I've got Phoebe on the line, and Phoebe's an expert in the Honeywell pieces that are out there. So Phoebe, could you talk just briefly about some of the functionality of the Honeywell devices?
Absolutely, Shane. Thank you. So yeah, of course, you mentioned for this type of application, you do need some sort of mobile handheld device to be able to support that. So Honeywell, and hopefully Honeywell is a familiar name for those of you on the line with us today. Maybe some of you even currently use our Honeywell devices. But we can specifically support this application through a number of means of mobile devices. We have both an enterprise mobile handheld computer that is built for a healthcare environment. So it features Honeywell signature disinfectant-ready housing. So like any other workflow in your organization that you would use your mobile handheld device for, it has all of the features that you mentioned previously from a device that you would need to be able to support this. So it's built for the healthcare environment. It is supports the Android platform. It has a built-in 2D scanner, so it gives you all of the same capabilities that you don't have to have just a separate barcode scanner. It has that barcoding scanner built right in. And then, of course, it does have the camera as well. So as you mentioned, being able to capture pictures with this workflow to give a more accurate description of that belongings. It's everything that this enterprise mobile device terminal can use. And so that's for our Android users, right? We know that there are a lot of users out there who are running an iOS device. So whether that's an iPhone or something similar, you still need protective casing. As we know, iPhones aren't specifically built for a healthcare environment. So we do have our Captuvo sled line, again, that supports iOS devices. And it has that same build for a healthcare environment. So it also features our disinfectant-ready housing so that you can wipe down, sanitize as much as you need to. it has that built-in scanner, so you're not having to download and utilize a specific scanning application. And then it also features a battery pack, so you don't have to take it off the floor. So we know, especially those who are dealing with patient belongings and patient tracking, you don't have time, to go off the floor if you're trying to intake a patient, take their belongings, track it, take pictures, tag it. We want to make sure that the device that you're actually using to fulfill this, that you have the right device in hand. So these are just a few. Honeywell offers a lot of them, but we proudly support and integrate this patient belongings tracking application on our devices.
Great. Thank you, Phoebe. So just give you a sense of the flexibility and how we capture it, right? And so we'll jump forward from there. And we talked about this a little bit already, but, it needs to be a mobile. We talked about delivering at the point of care, the point of service, the point where we're actually collecting the patient belonging. It needs to be a mobile application. It needs to be web-based, right? So, raise your hand virtually anyway if you've heard it's in the cloud way too many times, but it needs to be a cloud-based application. And it's not because having it in the cloud is cool. It's because having it in the cloud allows it to integrate with your other systems that are out there within your facilities, as well as provide visibility and access to it for everybody that needs access to this information, who's authorized, of course, right? And so you can see just in this example, we have the facilities. Every facility is going to be a little bit different in terms of what their signatory requirements are. So we just build your signatory requirements into the web-based application, and much like when you receive a package from FedEx or UPS, that a patient or family member can sign off on that, what has actually been captured out there. So to give you a sense of the overall process flow, you can see the top there really refers to, it's a fairly busy slide, but as you know, you're very busy people, so there's lots of things going on out there. So in a very simple way, without going through a video here, we scan the patient's wristbands, we scan the property bag that these items are going to go into, we collect, review those belongings. If we want to take photos of the belongings, we can do that at that point as well, place them in the bag, the patient signs off on it, we put it in a storage location, and we sign off on it. We know exactly who we took it from, we know exactly who took it, what bag it went into, what location it went into. At point of discharge, scan the patient's wristband, pulls up the storage location, I can retrieve the property, provide it back to the patient, and the patient can sign for their property, right? So all in a mobile application, much more user-friendly experience than, hey, let me go try to find it, right? It's a better experience for quite frankly, the frontline worker as well as the patient, right? So very straightforward process, and we're actually, if you want to, from an enhancement standpoint, put it to a point where we can send family members a link, right, and they can look up what belongings have been captured by from their relative that's been onboarded. Okay. So simplifying the method for each of the different items that we're collecting, can record any uniquities in terms of condition, right? Somebody walked in with a Rolex, right? You know that it was a Rolex. You know that it had a smashed front face, right, by the photo that's out there, so you can record the condition of the information that's out there, right? And then, again, just overall improve the efficiency of the process and reduce the opportunity for false claims, right? Hopefully people aren't doing too many false claims. I think we all have enough things going on in our lives, in particular the folks who are on the phone here today, without people filing false claims, but folks are folks, and this will help to avert that. Right? Much like the homegrown systems, manual systems, right? You're getting a specific patient signature that this information has been collected, right? Difference between a manual system and this is you can automatically retrieve that through that web-based application, right? I talked about using the facility language that are out there. And, every facility is a little bit different in terms of their policies and where they're going to store things and who can sign for what. And we can adapt the system. It's built flexible enough to be able to adapt it to your particular needs that are out there, right? All right. And, from a staff standpoint, it's one less thing to worry about, right? You're out there and you don't have to think about, where patients' belongings are. You know where they are. You have visibility to that without having to call security. Right? In terms of the employee interaction with it, right? You can see this. I can capture that information. You can see an example. Somebody captured the watch information. You know where that watch is. You know what bag it's in. You know what location it was put in, and you've got a full audit trail and a full log of all the information, a full chain of custody piece of information to be able to track exactly where that patient belongings are. Right? We've designed this. We spent a great deal of time with a lot of frontline workers helping us to design the user interface on this to make sure that it's appropriate and easy to use. Make sure that it's intuitive. We don't want to have to go. We will provide training for the system, absolutely. But if we can provide it in such a way that it's an intuitive application, I think everybody that's on the webinar with us today probably uses 1 or 100 different apps out there. So build it in a way that's very intuitive for that end user. They can pull up the app, and it's going to walk them through it in such a way that that we don't have a big learning curve that's out there. And again, customize it to your individual facilities, policies and procedures that are out there. I talked about the software being a cloud-based application. It's designed with a full mobile user interface, whether it's iOS or Android, purpose-built device or a personal device that's being used in the healthcare setting. From a hardware standpoint, Honeywell has years and years of experience, and most of the folks that are out there on the webinar today probably have a number of Honeywell devices. They're excellent in the scanning and mobile computing world in the healthcare space. So this is just another application that the Honeywell family of products is helping to support out there. And also, Phoebe talked about that sled that's out there. So if you're an iOS shop, you're kind of type of facility that's using a lot of Apple devices, where you can still take advantage of the Honeywell technology by adapting a sled to that device to help you provide a better scanning experience. Okay. So at the end, at the end, when we get done with, we've implemented this, how does it affect people within the facilities? And I'm hesitant to read things back to people, but I think there's a few key areas in here to talk about. We talk about nurses or other frontline workers that are out there, right? Streamline that process, right? Make it easier on those end users to capture patient belongings. They want to make sure that they get captured, right? Let's make it as easy as possible, both in terms of on the intake as well as at the time of discharge. Make sure that it's an easy process for that out there. If it's easy and I don't have to do a lot of additional paperwork or keying into other systems or find a mobile cart to go pull over to try to collect this information, I can just do it real time at the point of collection. They can spend more time on focused on patient care, all right? And also when I'm looking at the discharge time or a patient that's in a room, as, hey, where's my belongings, that nurse has full access to exactly where that patient's belongings are and can provide with a mobile application visibility to that patient, right? So it's about visibility and it's about transparency that's out there. In terms of patient experience directors, improving your survey results that are out there, whether it's the HCA, HPS, or internal reviews within your health system, reducing the amount of reimbursements we're having to do for patients because of lost items, and also to provide a better experience. That's a different, unique kind of experience that patient's going to have at your facility that they might not have at another facility across town. And if you're in a place like Baltimore, a very competitive healthcare marketplace here, and these things help make a big difference. All right, from an IT standpoint, facilities director standpoint, it's not a system that it certainly be a project associated with it, but it's an easy-to-implement solution, right? How many times everybody's heard that, I'm sure, right? But, it's not something that's going to take years to implement, and there's not a 2.0 version coming right behind it. We do upgrades to the system, but it's not like a full-blown EHR system that you have to deploy out there. It's the sort of thing that you can implement a system easily. We've taken compatibility in terms of our ability to use different kinds of devices into mind. We provide a full set of web-based training and administrative tools to help the IT staffs and the facility directors actually implement these systems that are out there. So there's benefits across the board. It's not just for the frontline workers or the patient experience directors or the IT staff. It's really one of those systems that's going to have a very positive impact across the board. Okay. Is it worth it? Is it worth going through a process or a project like this? If the direct cost of lost belongings can be $50,000 to $100,000 a year based on our research, investing less than $50,000 just from a pure financial standpoint, without all those other benefits we talked about, we believe that it is. We believe that it's something that's going to have a very positive impact financially on your organizations. So just in summary here, before we get back to taking some of the questions that are sitting out there, we all know this, and it's probably as many of you were driven to attend this webinar by these kinds of things as anything, right? You want to do a great job for your patients, right? You want them to make sure that they get their belongings back. You don't want them to have a bad experience. And it's not because it's a hassle, it's because you care about your patients, right? It's because you're trying to deliver that great patient experience out there, right? And so, you're supporting those patients, and as importantly, in so many cases, you're supporting the families along the way, right? You're removing one more roadblock to a great patient experience. All right. So just quick summary here, without going into too much detail. Talk about barcoding a little bit. We're an organization that's been in the space, in the supply chain automation and asset tracking space for a long time. We're a company that focuses on automation and innovation in the supply chain industry. Our whole goal is to help organizations become more efficient. We talked about that, right? Freeing up time for those different classes of people within your organizations. More accurate. We talked about that as well, and that I can capture information once. I don't have to write it down and then key it into another system. And then lastly, connected. The way it's designed is designed to be able to connect to your other systems that are out there for complete visibility to those patient belongings that are out there. Right? From a mission standpoint, why do we do what we do? It's fairly straightforward, and it's a message I have the pleasure of delivering quite frequently, both internally as well as externally to our clients and with our partners like Honeywell out there. Right? And the whole goal of our organization is to be a consistently profitable, growth-oriented, sustainable company that we want to have a positive impact for people to have personal success, having that positive impact on our employees, our customers, our business partners, and our social communities. You can see some of the different groups that we support out there. It's something that we feel very compelled in any of our 7 offices across the U.S. and Canada to make sure that we're very active in our community out there and supporting them. All right? It's something that we've been doing this for over 20 years. and we're missing one of the bullet points out there on this slide, but one of the things that I think summarizes that we're people, right? We're certainly a corporation and we're in business and all those things, but at the end of the day, it's all about the people, right? Are you people? Is it somebody that we can trust? Is it somebody that has experience? Is it somebody that is creative? Is it somebody that's continuing to invest in new things like a patient belongings tracking system? Those are the things that Barcoding as an organization is focused on. I talked about the 7 locations around the U.S. and Canada. We service people throughout the United States, all 4 time zones, as well as all 10 provinces up in Canada through these various offices that you can see on your screen right there. Okay. Phoebe, why don't you just talk a little bit about Honeywell? Honeywell's a kind of a familiar brand name, but I thought it's good for people to really understand from a healthcare perspective, where is Honeywell in that marketplace?
Absolutely, yes. Thanks, Shane. So again, yes, Honeywell, hopefully many of you are familiar, but just to talk about our presence in healthcare, so we have decades of a global presence within the healthcare market that we strive to deliver solutions to keep your workforce more efficient, effective, and productive to help you deliver the best-in-class patient care. So like I said, hopefully you all are familiar with Honeywell. You may even use some Honeywell devices in your organization today. So again, we have been serving the healthcare market for decades, providing data capture equipment like barcode scanners, handheld mobile computers, and then we have label printers as well that are built specifically for a healthcare market. So just a bit about Honeywell in the healthcare space. A couple of fun facts. So we were the first, we have a lot of firsts there listed, but we were the first to introduce a lot of data capture and scanning technology for the healthcare market. So first to introduce the disinfectant-ready housing, both for scanners and mobile devices. We were the first to introduce some laser-free, programmable Bluetooth, hands-free scan lamp applications, and one of the first color scanners as well. So this just kind of speaks to our presence in the healthcare market and how we continue to develop devices that are going to help meet the needs of your organization. And then just a bit about if you're a part of an IDN, so we got about 80% of the top 20, 74% top 50, and 69% of the top 100 choose Honeywell as a premium vendor and then also utilize some of our Honeywell devices and technology today. So we are very familiar with the healthcare market, continue to have the healthcare market as one of our primary customer profiles and continue to want to serve the needs of the healthcare market that you all have with your devices, and then also partnerships. So as I mentioned before, we are very excited to partner with Barcoding, Inc. To help bring this application to the market. It is very needed, as we can see. I know it's an important topic, especially to all of you joining us today, but we do have, just in the healthcare market alone, we do partner with some of the top providers like Cerners and Epics of the world, and a lot of other healthcare organizations as well. So thrilled to be a part of this and very excited to support Barcoding, Inc. and this solution for healthcare.
Great. Thank you, Phoebe. I'm reading my screen. There's so many questions that have come along here. I'm going to try to do my best to answer them along the way. But Rob, if you're on the line, you can jump in here. But so we've completed kind of the core quick overview of the system. A handful of things I'd like to share with the entire group here, and then I'll address a handful of the questions along the way. So For anybody that would like to actually have a demonstration, a more specific video or online demonstration of the system, we are happy to do that with anybody that makes a request. That we'll be sending out information where you can request a demonstration to get into a little more details, because I know this was somewhat high level and just kind of establishing what it is and why it is. So we'll be happy to do that along the way. There were also several questions in here regarding integration to existing systems. And I think what we'll do is to, rather than go down through the details of actually all the bits and the bytes of how information flows back and forth between your existing systems and the patient belonging systems from barcoding, what we'll do is we'll provide a systems overview or an integration overview for everybody that attended out there, and that will allow folks to be able to deal with, because everybody's using different systems. And so if I talk about Epic, somebody says, yeah, but I'm a Meditech user, or I'm a Cerner user, or I'm using brand X out there. That way we'll be able to narrow it down and address your questions very specifically. So I'd like to do that. There was a question in here that had come up regarding a patient's unwillingness to sign off. And, it's not for us to make policy for your facility. Whatever your policies are today, whether it's an automated system like we're proposing today for patient belonging tracking, or it's a paper system, there's some policy that exists within your organization today. Know that we will just follow your policy along the way and implement that as part of the system, right? So we can provide best practices or things that we've seen at other facilities that will certainly help maybe provide some guidance for you around the policy, but we're not here to make policy for a facility. That's, that will be something for your institution itself to do, but know that we can implement it along, and we will make best efforts to try to provide background in terms of what we've seen success with at other facilities like yours. All right. Let's see. Other questions? Rob, are you still on the phone here? Are there other questions that you've seen?
Yeah, there was one question that came up on how can I make a plan or blueprint improving our process for handling, documenting, and returning patient belongings and valuables?
Can you repeat that real quickly, Rob?
Sure. Yeah, absolutely. It's how can I make a plan or blueprint improving our process for handling, documenting, and returning patients' belongings and valuables?
So, again, it's kind of like the policy question. That's something that every hospital has some form of policy around that. And I would say it's a collaborative group. It's that same group that, that I spoke to earlier, right? It's your frontline workers. It's your safety and facilities folks or security people that are out there, and administration in terms of sitting down and developing a blueprint or at least an outline for what you're trying to accomplish with that in terms of both making it easier for the health system itself, improving the patient experience, as well as creating a system that allows for accuracy along the way. So we can provide some kind of best practices around that individually for each of the individual facilities that we're talking to. But at the end of the day, it's really going to be, we're going to recommend those people participate in some sort of working group to create a policy around this if one doesn't exist or one needs to be revamped. But it's really going to be up to the health system itself to kind of create that policy that's out there.
Okay. Another question pertained to multi-hospital systems, asking, is there a purchase program that would benefit a collaborated purchase?
So if you buy more things, do you get a lower price? If that's the question, is yes. As we've contemplated our pricing models that are out there, we've priced it in such a way that, a smaller community-based facility, this is an affordable solution. But also, if you're a multi-hospital system that also makes it affordable for that group and takes into account kind of the volume-based purchasing or the volume buying power of a larger system. So it's a very quick answer is if you have a lot more hospitals and need a lot more users out there and different facilities out there, we certainly do have kind of that enterprise level pricing model that allows you to spread that cost and reduce the cost across those facilities.
Great. Another question was having access to see exactly where the patient belongings are. Is this only available to staff on the floors? I work for patient relations, and it would be helpful to have access to that as well.
Yeah, so that I talked about providing a link that if the patient wants to authorize other people to be able to see that, the patient would always be able to see that link. It could be emailed or text message to them, that if you wanted to make that as part of the system that you could.
Okay, great. Also a question about how do you get buy-in from nurses?
How do you get buy-in from nurses? Make them part of the process. Right? Allow them to be part of the process of evaluating this. And, I wouldn't be so bold to assume I know what it is to be a frontline worker or a nurse out there. Make sure that they're part of the process. It's been my experience. I've been in and around the healthcare space for a number of years, but have never been a nurse or never worked in that profession. So make them part of the process. And it's not a matter of, hey, we'll run a buy-in and make sure that they're bought in. They're doing this every day. If you want to know what you're solving for, talk to the people who are trying to solve it every single day. So make them certainly part of any working group that would evaluate a system like this and be part of that implementation team that's out there. So the buy-in is to get them to participate in the process. And at the end, this is probably not great for our business, but at the end, the nursing staff says, we don't need anything else, right? We're perfectly comfortable with these manual systems that we currently have. It's going to be difficult to implement. It really is. But, I think if we walk through that process with the nursing staff and show them how it can help them and allow them to give us feedback on how we might change those screens around a little bit or different sorting selections, that sort of thing, to make their job easier, they will get bought in, but make them part of the process. It's not something that should be implemented to them. They should be part of the overall solution.
Great. Okay, great. Thank you. There were several questions around the pricing, particularly if we could provide a breakdown of the $50,000. Is the $50,000 annual investment per license per Honeywell handheld device? How many users does it cover? I think the other question I saw there was sort of a duplicate on that as well.
Okay. So what we can do, again, in the spirit of transparency, what we'll do is we'll to the entire group, provide our pricing model, right, so that you can see the specific breakdown on kind of that year one investment from a licensing standpoint. That year one investment, if you actually need additional devices to be able to do this, and kind of what that long tail looks like in terms of the ongoing cost of operating the system from a support and a licensing standpoint. So we'll provide details around that to the entire group.
Great. Another question, a related question to that, are there variations in sizes? Could it be used in certain departments and not just the entire facility? For example, inpatient versus outpatient, ER, surgery, et cetera?
Yeah, so that's something that's come up. As we started down this road, we really didn't contemplate it as much. But a lot of the med-surg facilities that are out there are very interested in this sort of thing. Same issue, right? Different scale. So even if a really large organization, if there was just one department that wanted to do this for their group, we could absolutely do it in that group. Right, I'm sure we have to get blessings and all those things from the IT staff and the infrastructure people and make sure that we're not breaking any of the internal policies or rules for those facilities, but we can absolutely do that. And in that case, from a pricing standpoint, if you're a 1,000-bed facility and you're only using it for one department, We would just, the pricing would apply to just that one department. The price would be more like that small community-based or mid-service center.
Great, thank you. Another question, does it have tracking? So if there's an app, the patient can be reassured the location of the belongings, so I think pertaining to sort of chain of custody and tracking of the property through the patient visit?
Yeah, so the answer is yes. So that patient will always have access to who took the belongings, what belongings they took, when they took them, where they took them, and where they currently are. They will have full visibility and transparency to that all the time.
Okay. There were a couple of questions about specific items that can be tracked. One was items that a patient might have on, be wearing themselves, jewelry or clothing, as well as another question pertaining to hearing aids, glasses, and dentures. So the question is around what sort of items can we track in the system?
Yeah, so let me scan back here. It's not an exclusive list, but if we go back here, it'll give you a list of some of the items that show up on that end user screen. So you can see on this, right? Glasses, hat, other, pants, phone. And then below that, anywhere where you see the little caret, you can add more detail around that item. And if there are other items that are contemplated, like jewelry, if you want to distinguish between rings and bracelets and necklaces and all the different kinds all of those, it is configurable by facility. So if you want to add other pieces to this extensive list, we can certainly do that. It's part of it. It's not an upcharge either. It's just part of the system and the overall configuration of the system.
Okay, thank you. Another question, who would be responsible for scanning and collecting the belongings? Patient registration, ER staff? What if patient's family bring more things later once the patient is admitted? Who scans?
Yeah, so again, those are all policy questions and procedure questions within the facility. So whoever's capturing it today, right, if you don't have a patient belongings tracking system in place or an automated system like we're talking about today, something's happening today. So our recommendation would be to at least review that current process and policy that you have in place prior to the implementation of this. Maybe use that as an opportunity to improve it. Implement the system, and then you can modify that policy and procedure after the system is already implemented. So in terms of who is responsible for it, when are they responsible for it, those things can change based on your policy changes. What was the rest of that question, Rob? There was another piece to that.
Oh, it was, okay, so the question was basically around who would be responsible for scanning and collecting, and then what if the patient's family brings more items later once the patient's admitted?
Yeah, so you have the option today. It would just create another patient record, so there would be a second link for that one patient for those additional belongings that were brought in, right? And so, again, it gets down to a policy decision, right? So are we just doing this to collect things when people are being brought into the facility, as kind of the intake process, or do you want to add additional items that are being tracked that a family member or somebody has brought in for that patient during the course of their stay? And really a policy decision, but certainly we can manage that with the existing application.
Great, thank you. I believe that's the majority of the questions. I know we're coming up right on the top of the hour also.
Yeah, this is Jen. I just would like to say thank you so much for everyone who joined, and thanks to Shane and Barcoding Inc. along with Phoebe from Honeywell. So I just wanted to thank everyone again and let you know that you'll be receiving an evaluation, and we would love your feedback. And I believe the Barcoding team will follow up with you. And Shane, I don't know if you have any kind of next steps that you just want to share right now before we head out.
I'll just real quick, because we're being respectful of people's time, but thank you all for participating in this. Look for the follow-up items that I committed to during my component of this, with the questions in terms of integration questions and pricing breakdowns. We will push that information out to the group, and certainly are available for follow-up demonstrations or more specific facility-based questions along the way. You've got the contact information there, and I think this is going to live and breathe on the AHA site for a while.
Yes.
So
yes.
Certainly welcome to reach out to us through that.
Yes, this will be recorded, and we'll notify everyone once the recording is available. So I want to once again thank you all for attending, and thank you to Barcoding Inc. So I hope you all have a great rest of your day.
Thanks all.
Thank you. Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this afternoon.